We are back now with NBC's Anne Thompson, who's going to join us in just a moment. More with that exclusive story that she'll have tonight on NBC Nightly News about the work happening here at Roswell Park in Buffalo. And we really appreciate you taking some time with us here this evening. And as a cancer survivor yourself, I imagine this has been quite the story for you to cover. Share with us, if you can, what you make of the conversation you had with Dr. Fenstermaker and the others who have been involved with this.
Yeah, it's really exciting, and perhaps this is the future of cancer care. They have developed a experimental vaccine at Roswell Park called Cervax-M, and it targets brain cancer that comes back after standard of care. That's surgery, chemotherapy, and radiation. And it works like a flu shot. You get it in the arm. You get 4 doses over 2 months. There's an MRI, and if the cancer hasn't come back, then you can get booster shots every 2 months after that. And the theory behind it, Michael, is that the vaccine targets a protein on cancer cells called survivin, and that's the protein that helps keep cancer cells alive. And the theory is that if you kill that protein, you'll kill the cancer cells. And the vaccine, and it's experimental, but it is currently in clinical trials at more than 10 hospitals across the country. Pretty exciting news coming out of Buffalo, Michael.
A little bit of the conversation that you were having with the doctor there, and you said remarkable when he told you that this has more than doubled the life expectancy for some of the people who are part of this. Again, it doesn't have full approval yet, but talk about the human aspect of this and the impact it's having on people's lives.
Yeah, because I can tell you as a cancer survivor, when somebody tells you you have cancer, your life shrinks. And especially when somebody tells you you have glioblastoma, because the average survival rate is 14.6 months after diagnosis. In an early trial, they found that life expectancy doubled, 28 to 30 months. And really, when you think of it in life terms and life event terms, that's what you're living for. It could be a graduation, maybe a wedding, maybe even a grandchild. That's the stuff you want to be around to see. And so that's some really positive news. Other things, side effects, they say it's like a flu shot. You get a sore arm. And the patients, and especially one patient we talked to who is from Buffalo, he says he feels normal. He's working around the house, getting things done, and is very happy to have this vaccine. Michael?
Yeah, we've covered this for a long time, and to get these, again, not final results, but promising early results from these clinical trials is so exciting. Make sure you stick around to see Anne's full story at 6:30 tonight on NBC Nightly News. Anne Thompson joining us from New York. Anne, thanks so much. It's good to see you.
Take care, Michael.